Assalamualaikum warahmatullahi wabarakatuh. Today, we are going to present on the quality of healthcare in Malaysia. Malaysian healthcare system, also known as one of the world-class healthcare system. With a score of 95 out of 100, Malaysia ranks first in the healthcare category of the International Living Annual Global Retirement Index 2019. Medical care in the Southeast Asian germ is simply world-class with a modern and sophisticated infrastructure. But does that mean Malaysia's healthcare system has already perfect to serve the nation? Before we start on the critical issues faced by the healthcare system in Malaysia, let us look at the parties involved in handling healthcare in Malaysia. There are two ministries involved in this matter, which is Ministry of Health and the Ministry of Finance. The Ministry of Health is the government agency that lead the healthcare matters in our country. The head minister of Ministry of Health is YB Datuk Sri Dr. Adham bin Baba and assisted by Director General of Health Tan Sri Datuk Sri Dr. Nur Hisham bin Abdullah. Other than Ministry of Health, Ministry of Finance also involved in this matter. The head minister of Ministry of Finance is YB Senator Tengku Datuk Sri Zafrul Tengku Abdul Aziz. Now, why Ministry of Finance involved in the healthcare system in Malaysia? This is because Ministry of Finance directly involved in the preparation of budget for Malaysia every year. As we know, recently our head minister of Ministry of Finance had tabled country budget for the year 2021. Here is the comparison between budget allocated in year 2019, 2020 and 2021. The government has allocated 31.9 billion for the Ministry of Health under budget 2021, marking a marginal 4.3% increase from this year, which is 30.6 billion budget amid the COVID-19 pandemic. Now, how do we measure the quality of the healthcare in Malaysia? Is it by the cost of the services, or the effectiveness, or the efficiency of the services? In this presentation, we are going to list few issues arise in our healthcare system. The first issue is on the lack of educational talk and awareness. It is on the importance of vaccination. Child vaccination should be made compulsory for newborn babies especially. This is to ensure that all dangerous disease can be prevented because babies and children are among the groups that easily infected by any viruses because of their low antibodies. The recommended solution for this issue is law enforcement on child vaccination. Government should enforce law on child vaccination, which means anyone who intended to give birth either in government or private hospital must oblige with the law. The next awareness is on early prevention and detection for cancer. According to Malaysian National Cancer Registry report for 2007 until 2016, the number of cancer cases increased for the past 10 years, where breast cancer has the highest percentage among all types of cancer. Our recommendation for this issue is subsidized medical checkup for high-risk patients. This is where government should play its roles, where patients with family history on having cancer, their medical checkup on cancer should be subsidized by the government, especially for the family with low income.
The second issue that we have noticed is the incompetence of junior doctors. Nowadays, concerns are being raised about the quality of young doctors in Malaysia. Some senior specialists in the government sector have confided that up to 30% of the junior doctors in service are dangerously incompetent, which may lead to misdiagnosis and delays in diagnosis. This issue was arise because over the years, the government has allowed a mushrooming of private medical college in the country. As the requirement to enter the private medical college is lower than public, everyone can enroll to this college. Due to the huge amount of medical graduates, there is insufficient number of spots to train them. As a result, medical graduates showed a lack of clinical and hands-on practice such as teaching wounds or taking blood samples from the patients. Lastly, there is a shortage of specialists in government hospitals. In 2013, 40% of the specialists in public hospitals were managing 70% of the inpatient load and the training of a new generation of doctors. Some of the specialists migrate to the private sector within a few years. The adverse consequences is there is the inadequate supervision of junior doctors, which lead to the incompetence of the junior doctor. So, what has been done by the government to solve this issue? Firstly, the government is attempting to spread the trainee doctors out by allowing more district hospitals and clinics to take them in. Currently, there are 44 teaching hospitals in the country, so the government plans to open 2 more new training hospitals for the trainee doctors. They also suggest to allow army hospitals to take the trainees too. So, we are thinking of some recommendations to improve the solution provided by the government. Firstly, we want to stringent the quality control on private medical college and graduates from unrecognized medical college. Government, especially Malaysian Medical Council, need to review the quality of private medical school. The college need to fulfill certain requirements in order to be recognized by the government. The government should also revoke their license if they fail to meet those criteria. Secondly, outside the service of specialists for private hospitals to supervise the junior doctors. Currently, there is insufficient of specialists at government hospitals and they don't have enough time to supervise the junior doctors. With this solution, it might help to lessen the burden of specialists at government hospitals. Lastly, the government should allow the trainee doctors to have a clinical training at private hospitals and be supervised by the specialists there. We can see that the incompetence of junior doctor is came from the lack of training and there is short of placement to the training. By doing this, it might help the junior doctor to have a sufficient training and prepare them for the future.
The third issue we want to highlight here is insufficient financial aid from government. According to the budget 2021, we can see government has made a huge cut for budget for public healthcare. The budget for general medicine has been cut by 14.28%, which the budget decreased by 247 million ringgit Malaysia. And the budget for pharmacy and supply has been reduced by 73.58%. And the budget for the disease control such as COVID-19 and dengue has suffered a 0.95% cut by 8 million ringgit Malaysia. The second problem is despite number of COVID-19 cases has caused the number of patients increase drastically and the hospital became overcrowded with COVID-19 patients, especially in Sabah. This results to overwork and exhausted medical staff. And the last problem is ineffective preventive system has led to the drastic increased number of COVID-19 cases compared to the first wave of COVID-19 cases in the early year. This second wave has reached approximately 1,000 cases daily for the past 2 months. To overcome the stated issues, one of the initiatives government has planned in the budget 2021 is to give a one-off 500 ringgit Malaysia to 100,000 staff of the MOH laboring at the frontliners of combating COVID-19. Our recommendation for this issue is to be focusing on the human capital development, where government can provide more permanent posts and appropriate allowances and an incentive to appreciate their battles. To overcome issues of overcrowded situation at hospital in Sabah, government can build temporary healthcare infrastructure to place the remaining patient at a suitable place. The last recommendation is government have to focus on public health system where they can upgrade the MySejahtera application to be able to alert the user if there is case at the place where user had visited in the past 2 weeks. So user can do a swab test as soon as possible and self-quarantine to avoid numbers of infection to be increased. The fourth issue we want to highlight here is the shortage of medical devices and facilities. One of the issues arise is the shortage of protective gear and low quality material of PPE had to be used by the frontliners. The issue becomes worse when the MOH and NGO has to collect the donation from the public to acquire more protective gear and some of the PPE pursued by the university student and Malaysian prison inmates. Another problem under this issue is the shortage of medical technology for the critical disease treatment. This problem has caused most of the people are unable to get the treatment due to the huge cost will be charged on them. Last problem is there is a small amount of mental health center provided by the government to suppress the mental health issues. In the budget 2021, one of the government initiative is they want to allocate 380 million ringgit Malaysia, which will be used for the provision of PPE and hand sanitizer to MOH frontliners. Our recommendation to overcome the stated issues are to put the priorities for the budget allocation to the MOH. This is to allow MOH to provide high quality of PPE for frontliners and no need for public crowdfund to purchase the PPE. Next, the government should utilize the tax paid by the public by giving more subsidies on public healthcare to reduce medical costs for the unfortunate household. This more or less can help reduce the burden of high cost of treatment for the critical diseases. Lastly, government should provide more mental health services or more mental health center, especially for the frontliners involved in the COVID-19 battle, for the children who have undergone prolonged isolation, for the adults who have experienced a job loss recently, and also for whoever in need of mental health consultation.
In Malaysia, there are 196 community clinic, 668 public dentists, 2,838 health clinic, and 145 public hospital altogether. Even the number of these medical facilities seems many, but the most common complaint about these facilities are they are usually overcrowded, especially in the area that are high number of population such as Kuala Lumpur and Kajang. Among the complaints said, the waiting time for them to get served are too long, might be because a limited number of doctors and specialists at the clinics or hospital. It also might be because insufficient medical equipment and the small size of clinics or hospitals. In some high population areas such as Kajang and KL, the size of the hospitals and wards are too small that they are not able to cover 6 patients in those areas efficiently and effectively. Minister of Health or MOH already aware of these issues and they already come up with some solutions. Among the solutions are the hospitals or clinics will deliver medicine to patients' house by post. Some hospital and clinic even open up drive-through pharmacies and pharmacy appointment system. The minister also tried to reduce the number of people in public hospital by shortening visiting hours and prohibit children below 12 years old at hospital for visiting. In some cases, public hospital also will send some of their patients to private hospital and the private hospital will charge only the cost price of the treatment for patient referred by the government hospital. Besides the solution proposed by MOH, we recommend the government to hire more competent doctors, nurses and health assistants to reduce patient waiting time, especially in hospital and clinics that have high population community. We also suggest the government to build more buildings and wards in overcrowded hospitals. This solution will incur lower costs than to have opened up a whole new hospital that will require more expenses. The ministry can also help more health and educational talk to raise awareness that citizens must be responsible of their own health, and their health starts from their home. It's difficult for us to achieve best quality of health in Malaysia when there are some group of citizens who are left out to receive medical treatment. These group of people facing the difficulties as they live in remote areas which are far from the provided medical facilities provided by the government. Usually, in their residential area, there are clinics that we call clinic desa. However, since the clinics usually receive a significant number of patients, the clinics are barely alive and have minimum medical equipment. In addition, since the size of the clinics are small, it is difficult to upgrade their medical services as they have limited space to even to store medication in the clinics. Thus, in order to ensure that these rural area community healthcare are well taken care of, we recommend the minister to increase the number of mobile medic team using mobile clinics. Besides that, we suggest that the nearest clinic kesihatan or public hospital should regularly visit this rural community to give routine health checkup and give medical talk. Lastly, we suggest that the minister provide online platform so that it is easier for rural area community to get their medical process such as registration, appointment scheduling, case referral done before they have to travel to the clinics or hospitals that are usually far from their home. In conclusion, Malaysia has steadily strengthened its healthcare system over the years. The prevalence of medical schools and high-end hospitals offering outstanding facilities shows that Malaysia not only offers quality healthcare to its residents, but also to immigrants and tourists. However, despite government dedication, they need to draw attention to some issues that need to be improved from time to time. That's all from me. Thank you.